Bunion, also known as hallux valgus, is the most common deformity of the foot accompanied by various complexities. The condition can be anatomical, meaning the structural issue and the limited range of motion pose challenges, or functional when there are difficulties with the muscle function of the foot. The treatment of this condition is always individualized, and that's why it's essential to truly explain the background so that you can manage your condition with the straightforward measurements. If you are seeking comprehensive information about the condition, then you are at the right place. The video is lengthy, so the timeline is provided below, allowing you to access the specific segments. The phenomenon is diverse, so I recommend watching the entire video first and then using the timeline when you want to refresh your memory about the particular aspect. In the case of the bunion, crucial factor is the position of the first metatarsal bone here, and we are referring to the alignment of this bone. If the angle of this bone is compared to the abductor bone begins to change, different degrees of alterate are discussed. If the angle change is less than 15 degrees, it's considered normal finding. So if you don't experience pain or other symptoms, you can continue as you have been. However, if the angle changes exceeds 20 degrees, it starts to move into abnormal territory. In changing cases, the angle may be even 45 to 50 degrees. The key point here is that if you only have aesthetic concern, no pain, there is no need to be overly concerned about it. What kind of typical symptoms might be present in the background? The first generation, what comes to the mind is inflammation. In that area around the joint base, there is a redness, aching, roping feeling present, and temporary relief can be obtained with anti-inflammatory medication. Another scenario may involve pain or sensation of the joint when wearing shoes, and if the friction continues, the skin in that area may typically thicken as a result of the rubbing. Typically, if there is a restriction in joint movement, the pain gradually intensifies with the increased strain. How does the bunion affect walking? If we break down basic walking into three fundamental phases, the first is the heel strike phase. During this phase, the heel strikes to the ground, the ankle joint is well bended to 90 degrees angle. The shin and the knee are well aligned, taking the load. At this point, the force vectors are contributed nicely across the multiple joints. Moving to the mid-support phase, our body mass is straight line on the foot. When the body mass begins to shift onto the foot, typically with bunions, the weight is directed to the outer edge of the foot or the foot is outward rotated. As we transition into the toe of phase, the limited movement of the base joint of the big toe prevents the smooth toe off. Why do we need that toe off? Well, we needed the activation of the windlass mechanism. When the big toe starts to bend upward, the membrane structures in the sole of the foot, plantar fascia, begins to tighten, effacing the arc beneath our foot. This mechanism is like a spring, permitting the structures of the sole for moving during the toe of phase, providing easy, accessible additional energy for walking. However, if there's a clear restriction of the upward movement of the big toe, then the windlass mechanism won't activate, and the force will need to be sourced from elsewhere. In such cases, the symptomatic foot may easily tire, especially during the activities like walking. Walking should be the most economical form of movement, light and easy. If we have to walk with impaired big toe movement and the leg is externally rotated even during the mid-support phase, then that economy begins to suffer. Another crucial element in the walking is the supination and pronation movement of the midfoot. If you want easy mnemonic, supination is like eating, twist like this, and the pronation is its opposite movement. If the muscle functions of the foot are significantly reduced, then the midfoot position may be constantly slightly pronated during the walking, and the proper arc structure cannot be activated in the inner side of the foot. What factors are be considered as risk factors and what factors may contribute to the development of the symptoms? Unfortunately, the women take a lead in here. The ratio between the women and men is 15:1. One major factor is the footwear. So if the tip of the shoe directs the base of the big toe towards the second toe, you are indeed creating unpleasant wedge for yourself and for your walking. If we think about children's foot, the base of the big toe and the area between the fifth toe are very wide. The advantage of the barefoot shoes is that there is certainly enough of the space in the foot area and the shoe doesn't not force the big toe towards the center line. According to 2016 men's article, the critical years for development of this condition for lifetime are between the 20 and 39. If anatomically you have long metatarsal bone or your joints are exceptionally rounded, alignment may start to deviate. Other factors may include stiffness of the Achilles tendon, pronounced flat feet like mine, abnormal muscle attachment, knee or hip osteoarthritis, high BMI, meaning body mass index. How in earth should one start treating such a condition? Now, let's categorize it into the two subgroups, manual therapy and active exercises. In manual therapy, it's crucial to understand that if the joint has been aligned towards the second toe for a long time, there might be limited motion at the base of the joint. For this reason, such mobilization may be appropriate when we guide the fingers to the base of the joint area where they haven't been in a while. When you start mobilizing, your face should remain neutral. If you are looking the base of the big toe from the side of the nail, the movement should raise the figure 8, and you can vary the directions. If the figure 8 seems incredibly challenging to grasp, then you can move large circular motion into both directions, clockwise and counterclockwise. If you have issues with the bending of the joint downwards or more commonly upward, in this case you can gently move the joint up and down with this technique. The key in mobilization is to bring the midfoot bone and the base of the big toe as close to the center line as possible. As through the center line, we need to achieve good bending upwards and downwards. If, however, there isn't extreme misalignment of the base of the big toe and the issue is mostly functional, then we need to start doing appropriate exercises. One incredibly important muscle is the abductor hallucis. If we had bunions for a longer period, this muscle structure is like to be highly stretched. This muscle originates from the inner surface of the heel bone and it runs along the inner surface of the foot, far side of the base joint of the big toe, distally. The role of this muscle is to pull the big toe into a straight line. Using the own big toe as an example, when I don't tense my big toe abductor, the upward flexion looks like this. Conventionally, when I tense the big toe abductor, the upward flexion looks like this. For this reason, in walking, it's crucial that your step rolls through the base of the big toe, and this muscle function is to guide the joint line in the straight line as possible. What kind of exercise could ignite this big toe abductor? Start the training preferably while sitting so the required force are minimum as possible. Think about the inner surface of the heel bone and the far side of the base joint of the big toe. In this exercise, you want to bring the distance between those 2 points close to each other. If it's challenging to visualize, sometimes in my practice I'll be lying on the floor, pushing the base of the big toe towards the heel bone while the client tries to figure out which structure of the foot needs to be tensed to achieve a similar movement. At some point, the light bulb turns on, and after that, repetition, and once again, repetitions. It will going to stick into the memory. At this point in the exercise, you notice that previously mentioned pronation movement can be slightly elevated into supination and outward rotation, where the middle part of the foot doesn't lie flat on the floor loosely. Personal experience. For some strange reason, women easily can grasp this exercise, while with men, various mental images and tricks are needed to achieve the right function. Wonder why? If you have been experiencing pain in the base of the joint area for a while, as a result of the pain, muscle function may be restricted. If you want to activate your big toe extensors and flexors, placing the resistance band between the big toes, performing abduction and lifting of the big toe into extension and down to flexion, it's beneficial exercise for the extensors and flexors muscle groups. Aim to perform the movement in a way that it lines with the metatarsal bone and the base of the bone of the big toe neatly at the same line. Next important element related to walking is the long flexor of the big toe, also known as flexor hallucis longus. If you press the base of the joint downwards and then lift upwards, if the final stretch is hard, then there is an anatomical limitation. and adhesion should be directed to manual therapy. If the final stretch is elastic, then the muscle group should be stretched as follows. Once the anatomical and muscle-related restriction has been removed, then these flexor muscles should be contributing to the walking. Going back to the toe-off phase, this muscle group shines with its presence. If the issue is pain, limited range of motion or weakness, start the exercise while sitting. Keep your feet flat on the ground. Place the weight at the base of the big toe and lift the heel off from the ground. Try to take the movement as far where you find the restricted range of motion of the big toe. If you feel pain during the movement, try to activate the big toe abductors simultaneously. If the collaboration of these two factors increase the range of motion with the less pain, you'll know what to focus on. If you want to progress this exercise, grab a kettlebell and place the weight top of the foot and perform the toe lift with additional resistance. When this becomes boring, stand up, take the symptomatic side behind and mimic the toe-off phase of the walking. Try to keep the weight under the big toe and do the heel lift. Pump the heel up into the air, ensuring that metatarsal bone and the first bone of the toe stays well aligned. For a handy progression, lean against the wall, perform the toe lift from the base of the big toe, sides with the both feet, and when it starts to feel too easy, then do the exercises with one foot following the same ideology. However, maintain the range of motion such that there is no intense resting pain after the exercises. It's better to have little discomfort-free and high-quality movement than pushing through the constant pain with strained face. How does the bunion affect the function of the big toe abductor in the long run? In a study conducted by Norgol and colleagues 2003, the functions of the big toe abductor muscle was investigated in a small research group. The study included 22 patients with the bunions and 20 volunteers. When the bunion group was tested, the force of the abductor motion for bringing the big toe closer was reduced, but emphasized for bending forward. In contrast, when the healthy group was tested, the abductor muscle was stronger compared to the bending. So to summary, the role of the abductor muscle is to support the pulling of the big toe closer, and if problems arise, it begins to take more of the role of the bending of the big toe downwards. With the bunion, the direction of the muscle group changes and it becomes more downward bend. For this reason, it is crucial to ensure that the muscle group is kept as an abductor, not as a downward bender. As for a dynamic exercise, consider this. Lift all the toes up, pull the base of the big toe towards the heel bone and lower the toes down. Repeat this rotational movement again and again. If you are multitasking talent, push the fifth toe as far as possible to recreate the movement what you had in a baby. If you are looking for tips how to modify the big load during the exercises, try these. If the pain occurs during the single leg squat, place the back of the foot on the bench. Keep the forefoot area relaxed in motion. If the pain is felt during the push-ups or planks, place something under the foot, allowing the movement through the ankle flexion only. Look for the shoes that allow much movement to the forefoot as possible. If, however, symptoms start to appear during the walking, choose the shoes with the wide forefoot but firm bending direction of the sole. This restricts the upward flexion of the big toe and helps to keep the symptoms more manageable. Now about the doses of the training. Identify the critical tasks for you from this video. If it's a mobilization, do it at the beginning, strongly emphasizing on this aspect. Once the range of motion restrictions are eliminated, then move to lighter exercises. Range of motion, having good abduction of the big toe, and pain-free toe-off phase are crucial elements. If you have had problems for a long time and bending up and down is challenging, use the resistance band for movement as well. When things start rolling, start upright and start engaging the windlass mechanism the way it should work. If I were you, I would pick fantastic song to the background, do the exercises 2 or 3 times per week, and if the light starts to appear at the end of the tunnel, walk with the good shoes and enjoy. After that, you will be unstoppable person. With this, I would proceed forward. And if the challenges arises, seek help from the professional who truly understands the functioning of the foot. And if you are wondering about the minimal shoes, check the link in here and see you at the next one.